Hello, my name is Masa Kamada. I'm a lecturer at the School of Public Health, the University of Tokyo, and serving as a member of the editorial board of the Journal of Physical Activity and Health. And I'm here with Dr. Yutaka Kimura. He is a professor at the Kansai Medical University in Japan. Thank you for joining, Dr. Kimura.
Oh, hi, nice to meet you. I'm very glad to see you, and actually, I'm very appreciate for giving us such opportunity to have our showing our papers in the online. Thank you very much.
Thank you. So today we will talk about a recently published paper from Dr. Kimura's team. The title is Effect of Mobility Restrictions During the Coronavirus Disease Epidemic on Body Composition and Exercise Tolerance in Patients with Obesity, Single Institutional Retrospective Cohort Study. So first, could you briefly tell us about the background and motivation for the study?
Okay. Actually, the COVID-19 is now some places going down, but still a horrible infection in the many countries. And it's forcing people to stay home and refrain from the physical activities. And there are lots of papers that restriction of physical activity in case unnecessary emergency affect lifestyle-related diseases such as hypertension or diabetes and obesity. And this is very important that issue that restriction of physical activity affects not only the people's physical activity, but also the physical, psychological aspects. So then when we think about for the treatment of obesity, um, dietary habits or physical activity and psychological aspect are important factors. Therefore, the restriction of physical activity with COVID-19 pandemic may affect the treatment of patients with obesity. Obesity is also the factor associated with aggravation of COVID-19. So our exercise trainer said, our obesity clinic said the less improvement of exercise tolerance may be seen after COVID-19 pandemic compared to the average year. So we decided to know how much effect of COVID restriction of physical activity in our daily life to the treatment of obesity. And if there would be some effect of the treatment of obesity, we have to make countermeasure for the restriction physical activity during the COVID-19 pandemic. That's the reason why we decided to study of this study.
Great. So what were the key results and any findings you want to mention?
Yeah, actually, our results showed that just regarding weight loss, there are no difference between COVID-19 and before COVID-19. So actually, we are satisfied our program for the obesity program despite COVID-19 pandemic. But the reason why the result is okay, there will be the good effect of our team medicine consists of the exercise trainer, nutritionist, and clinical psychologist. And also we using for the method of CBT, cognitive behavior medicine, that's a really good effect even in the COVID-19 pandemic. However, the decrease of body weight, body fat was significantly lower in the COVID-19 group. And furthermore, the rate of change in exercise tolerance obtained through the COVID weight loss program was significantly lower than the before the COVID-19. So there are two difference. Just body weight, the body fat decrease, and the exercise tolerance is a significantly change in the before the COVID-19. That's our
That's,
new result. Yeah.
that's interesting. So what are the implications for public health and clinical practice based on the study results? And what are your recommendations for future research given the limitations and findings of this study?
Yeah, thank you very nice questions. Actually, for the COVID-19, still there are lots of problems worldwide, and the physical uh, restriction of the physical activities is a big problem for the everybody's. And we just reduce the body weight. That's okay. It's some doing some diet or some exercise, but in the restriction of physical activity, the decrease of body fat is not good for in the COVID-19, and also peak VO2. I mean, for the oxygen consumption, physical activities is not good in the COVID-19. I mean, so during the restriction physical activities. So still we have to develop our new treatment program in spite of the COVID-19 and restriction of physical activities. So maybe we now developing with the method of remote exercise system, such as online exercise and online counseling. So these kind of online system is very useful for the treatment of COVID-19 um, period. But still, we think about for these new technology using ICT and IoT technologies using their obesity program. That's all. Thank you very much.
Wonderful. So thank you very much again, Dr. Kimura.
Okay, thank you very much.